Hello, everyone. We are Group 2, and today we're going to be presenting on the effects of ethanol, GABA, and lidocaine on the frog sciatic nerve, and I am Sarah Naughton.
I'm Stephanie Rodriguez.
And I'm Emma McDaniel. First off, why do we do all this? The purpose of studying the effects of each of these drugs is to see how the nervous system functions and interacts with the body. We observe these effects using extracellular recordings of a compound action potential to measure events such as threshold, max cap, conduction velocity, and refractory period. We first studied ethanol, which is a colorless liquid commonly used for recreational alcohol. Its chemical formula, C2H6O, is different from other alcohols as it has two carbon chains. We used a 0.5% ethanol solution, meaning it has a relatively low concentration. Ethanol's chemical structure allows it to affect the physical structure of the nerve's phospholipid membranes by interfering with the packing of the molecules in the bilayer. This causes an increase in membrane fluidity. As seen on the diagram here, on the left is a phospholipid bilayer membrane that is seen on the axon on the frog sciatic nerve. The phospholipids are directed with their heads pointed outwards and the hydrophobic tails pointed towards each other. Once ethanol comes into contact, it moves and dissolves in between the membrane and changes the structure of the phospholipid tails. This change of structure is an increase in membrane fluidity, and as seen here, causes the orientation of the protein channels to change as well. At low concentrations of ethanol, it is only slightly changes the membrane's fluidity. This causes the protein channels to increase their flow of ions, so we expect more sodium coming into the cell from the voltage-gated sodium channels. This causes lower threshold and a higher cap amplitude. At high concentrations, the membrane looks similar to the picture before, and the protein orientation is too shifted. This causes the voltage-gated sodium channels to need a higher stimulus to reach threshold, and once that happens, still less ions flow into the cell. This should expect an increase in threshold and a lower cap amplitude.
GABA is an inhibitory neurotransmitter present within the central nervous system and the peripheral nervous system and reduces neuronal activity by inhibiting nerve transmission. Specifically, GABA operates by changing ion channel activity within the cells and subsequently changing the electrical potential of neurons. GABA exhibits its inhibitory action by eliciting actions from GABA A and GABA B receptors. GABA A receptors are ligand-gated ion channels. After GABA binds to GABA A receptors, allow the ion pore to open and allow more chloride ions, which are negatively charged ions, to move across the cell membrane, thus decreasing the resting membrane potential of the cell. The decrease in the resting membrane potential of the cell will move the resting membrane further from threshold potential and result in hyperpolarization, making it more difficult for the nerve to elicit an action potential, thus resulting in an inhibitory effect. GABA B receptors is a G protein coupled receptor and exhibits its inhibitory effect in the following manner. GABA will bind to the GABA B receptor, activate potassium channels, resulting in hyperpolarization, and inactivate voltage-gated calcium channels, resulting in the inhibition of presynaptic release of neurotransmitters. Due to the aforementioned effects of GABA on GABA A and GABA B receptors, it is anticipated that GABA should have an overall inhibitory effect and make the nerve less excitable. Therefore, it is hypothesized that within the threshold and recruitment trials, it should increase the stimulus needed for the nerve to reach threshold and the stimulus needed for the nerve to elicit a max cap. Within the conduction velocity trials, it should decrease the conduction velocity, and within the refractory period trials, it should increase the length of the refractory period.
The last drug that we tested was lidocaine. Lidocaine is an anesthetic drug that is used for pain management as it disrupts the signals between nerves and inhibits the voltage-gated sodium channels. And in a sciatic nerve frog with high concentrations of lidocaine, it can cause irreparable damage to the nerve. Due to the disruption of voltage-gated sodium channels, action potentials cannot fire. This is due because of the different phases of action potentials, which starts with depolarization, then repolarization, hyperpolarization, and rest. In depolarization, the voltage-gated sodium channel is open and causes an influx of sodium, which causes depolarization to increase. Without the sodium channels being activated and open, it causes the action potential not to have its depolarization phase, which means that no active potentials could be made. Due to no action potentials being made, a summation of action potentials cannot make caps. And because there are no caps, it is expected that lidocaine would show no threshold, no max cap, no conduction velocity, and no refractory period. Essentially, it is expected that no stimulation would create any formation of cap and any data recorded. How did we test these drugs? We first harvested the sciatic nerve of a frog. We placed it in a nerve chamber, which was connected to the preamp and the power lab. We filled up the chamber with Ringer solution, which was used to keep the nerve from drying out and from dying if it was left alone. We used scope to record our data. The first set of data that we recorded were control groups, which was done for each drug. The control groups were essentially placed in normal conditions where no drugs were added to it. And then we would add the drugs. The drugs were placed in order from least toxic to most toxic. The least toxic was GABA, and then it was ethanol, and then lidocaine. And for each, we recorded their threshold, their max cap, their conduction velocity, and their refractory period. And this is our setup that we made for our nerve chamber, which was connected to the preamp and to the power lab.
So what happened to our sciatic nerve when we exposed it to these drugs? It was seen that as compared to our control, ethanol increased the threshold and the max cap stimulus. The increase of threshold shows that the A alpha fibers in the axon had a big enough increase in membrane fluidity to cause a shift of the voltage-gated sodium channels. The new orientation caused an increase in stimulus needed to reach threshold as compared to before. It was also shown that the max amplitude increased higher than the control. This can be due to ethanol causing an opposite effect on the smaller fibers, such as beta, gamma, or delta, meaning that there was just enough of an increase in membrane fluidity to cause an increase of flow for sodium and an increase their cap. Since it was shown that the A fibers were affected by ethanol, we see this again in conduction velocity as it decreased by 2.9 millimeters per millisecond. A decrease in conduction velocity is from the decrease of flow of sodium ions into the cell, causing a slower depolarization rate. For the studied refractory period, we did not see a significant decrease between the control and ethanol. However, this is due to the lack of precision in the technology. We did, however, see that more fibers with ethanol hit their absolute refractory period sooner by a lower cap2. This was once again due to the slower depolarization time in the A alpha fibers, as well as the slower repolarization time from the shifting of the voltage-gated potassium channels, which also causes less potassium ions to flow out, ultimately keeping the sodium channels inactivated for longer.
There was no change in the voltage needed to generate thresholds compared to the GABA from the control trial compared to the GABA control. Within both data sets, the voltage needed to generate a threshold was between 75 millivolts and 80 millivolts. This lack of change could be due to the lack of GABA receptors present within the sciatic nerve. Additionally, it's worth noting that there was an increase in voltage needed to generate the max cap of the control trial compared to the GABA trial. Within the control trial, the voltage needed to generate max cap was 375 millivolts, and within the GABA trial, the voltage needed to generate max cap was 420 millivolts. This indicates that GABA may affect the GABA or delta fibers more than the alpha fibers. The increase in cap amplitude after GABA was administered is very unexpected. This could be due to better conduction between the nerve and the recording electrode during GABA trials. Within the conduction velocity trials, GABA resulted in a decrease in conduction velocity by 3.42 millimeters per millisecond. This is due to the inhibitory effect that GABA B receptors have on transmission between nerves. Within the refractory period trials, there was no notable changes between the control dataset and the GABA dataset. This could be due to the lack of GABA receptors present within the sciatic nerve tested.
For lidocaine, the results for threshold improvement, it can be shown that there were no caps as expected being formed. And because of this, there was no way that a threshold or a max cap can be identified like it would for in normal conditions. For conduction velocity, it was the same thing. There was no caps in order to measure any time between T1 and T2, and eventually leading to no conduction velocity at all. And for refractory period, it would be the same. Since no caps were formed, there was no way to see any refractory period being formed, since no stimulation would cause any cap to form with lidocaine in the nerve.
So overall, we just wanted to remind everyone of what we learned. So ethanol increased the threshold potential, the threshold stimulus needed to generate a threshold, and had no effect on refractory period and decreased the conduction velocity. Within the GABA trials, there was no effect on the stimulus needed to generate threshold, no effect on the refractory period, and a decreased conduction velocity. Lidocaine essentially killed the nerve and thereby had no discernible effects on any of these trials. So within ethanol, the effects differed based on fiber types, and within GABA, the lack of expected effects could be due to alpha A and alpha B nerve receptors present, or due to the lack of alpha A and alpha B receptors present. And within lidocaine, the concentration that was used seemed to have killed the nerve since no stimulation generated a reaction. The blocking of sodium channels caused the nerve to not be able to send any signals or action potentials.